Hi everybody, in this video I want to show you how you can get the most out of your sanakey personal pain relief device using the settings in the sanakey and also the Keyphoresis, which is used to apply a cream or gel, and I'm going to use this Natural Harmony Joint and Body Rub, and then also show you how to use the pads and leads electrode to get the most out of your treatment. So three things: using the device, using the cream, and using the leads electrode. So let's, for the purposes of this video, assume that I have a shoulder pain, and what I'm going to do is use the 3 stages of sanakey treatment of scan, treat, and assess. Now this is all explained in the user guide and on the online training, and don't forget you can also get the app to have with you at all times. So let's first turn the device on. Really simple operation and intuitive use. Big screen, and what I'm going to do is, for the purposes of this video, is let's assume that I have a pain in my shoulder from overuse. So what I need to do is, the first stage of treatment, I need to scan the area. So I need to have the device on skin. So what I'm going to do is I'm going to put the device on and I turn the energy up until I can feel a gentle tingle. Now it doesn't have to be strong. You just need to be able to feel the impulse on the skin, and I can definitely feel that. In fact, I'm going to turn the impulse down. That's a little better. So now what I'm going to do is I'm going to scan the area. I'm looking for key points, which can be sticky points, painful points, and I want to find them because they're going to be my best way of treating the problem. So what I'm doing is I'm scanning the area. I'm looking for stickiness. Now this could take a few minutes, but take your time, and it's like painting a fence. And what's happened here is I have found a sticky point. So I can do one of 2 things. I can either hold it there, or I can be really active and try and get rid of the stickiness. Now the way I do that is I brush top to bottom, bottom to top, left to right, and right to left. And I find the most resistant direction. So I'm going to do that again. Top to bottom, bottom to top, left to right, right to left. Now if you watched just then, left to right is the stickiness. So I'm going to keep doing that, and you can see it getting quite red. I'm going to keep doing that until it's no longer sticky. And this is all we do. And once that stickiness has changed, you do it again. Top, bottom to top, left to right, right to left. And then what you do is you brush the whole area and assess whether there is no more stickiness. So then I've got to check, is my pain better? And if it is better, that's all I need to do. And if I'm satisfied with that, you can stop the treatment. But there's also this area, so I can reach around and treat that area. It's okay, but I'm reaching across, and some of you may not be able to get to areas that you want to treat. And that's where the leads come in. But before we do that, let's move to the Keyphoresis setting, which is where we can apply the cream using the device. Now on the device is a Keyphoresis acid or Keyphoresis base. Now you'll find that most of your creams, and let's choose a chemical-free cream using either essential oils for fragrance. You need a gel, good pain relief cream. This is a fabulous one that we use in the clinic now. And so I select KP acid. Now it's not a bioregulation signal like the pain relief signal that you would normally feel. In fact, you're not going to feel it at all. And what you use are these 2 ontophoresis electrodes. So let's see how I'm going to do it. So I put a little bit of cream on here, and I'm going to put a little bit of cream on my fingers, and I'm going to touch here to complete the circuit of the ontophoresis. And then all I do is I'm going to turn the energy up to about 50 or 60. Remember, you're not going to feel it. And I'm just going to massage the cream in. So it's really simple. All you do is I keep working, and that smells beautiful. And I massage the cream in. And what it actually does is activates the cream to go in through the pores a lot faster than you can rubbing it in with your fingers. Okay, so that's done. what I'm going to do now is I'm going to do the third stage of my treatment by using the pads and leads electrode. And to do that, all I do is switch the device off. And what the pads and leads electrode does is actually extends the treatment capability of your device. So it's a fabulous thing to use if you've got hard to reach areas. Now in the book that you get with your device, it gives you all areas to treat. And always, if you're not sure, give us a call. So what I'm going to do is I need to change the electrode head. So these are removable electrode heads, like that. And I'm going to pop the leads electrode head back in. And what I'm going to do is I'm going to apply an electrode pad here and an electrode pad here. So here we have 2 electrode pads. And what I'm going to do is put them onto my skin. But first of all, I'm going to attach them to the sanakey. It doesn't matter which one you attach, the red or black, because they're both the same size, and they're on these little plastic reusable pads that you can store them on. So I'm going to put one pad here, and that's stuck on, as you can see, and I'm going to put another one on the back area where I have pain as well. So it's always good when you're not sure where to find your pads is use the device on its own with the normal head to find that sticky spot. You can always put a pad on there and a pad on the opposite side. So you can use this for elbow pain, knee pain, wrist pain, lower back pain. So it's really good just to continue your treatment, or actually treat yourself in areas that you can't reach or you don't have someone else that can treat you. So there it's on. So I'm going to turn the device on. The settings that you actually use are explained in the book at length. So I turn the device up until I can feel a gentle tingle. And that's just pulsing nicely through my arm. And I can just sit down and relax for 20 or 30 minutes while it does its work. And that's all I need to do. So once I've finished, I just switch the device off, put the pads back on their storage, little plastic storage things, and then put them away. So there you go. That's some 3 ways of using your sanakey and getting the most out of the sanakey when you have pain.